Okay, it looks like the waiting room has slowed down a little bit. So we'll go ahead and get started. My name is Lena Tucker Reinders. I'm the Executive Director of Iowa Public Health Association. And we do these conversations every month just to share knowledge and learning and kind of what we're doing around the state of Iowa, make sure we're sharing best practices and we can all learn from one another. This series it's about I think, our fourth or fifth year in the series, and so we're always excited when we can bring new people to the conversation. This month's conversation is going to be facilitated by Sam Jarvis from Johnson County Public Health Department. He's also one of our board members. And so I'm going to turn it over to him just after a couple of housekeeping reminders. We are recording this session, so we will be posting it on our YouTube channel after we're done here in the next week or so. Your cameras, I think we have them set to mostly off right now. And that's just so we can save bandwidth and we can listen to Sam and Michael after he starts presenting. Towards the end, we'll have time for questions and answers. We'll invite you to turn your cameras back on mic, and ask questions. Anytime you can put a question in the chat, and Sam and I will be monitoring that and try to answer what we can. Otherwise, we'll pitch it to our speaker afterwards. And just a reminder that this Lunch Learn series is brought to you by the IPHA Education Committee. As a membership organization, we depend on the involvement of our members across the state. And if you're interested in this work, our advocacy work, communications, there's always a space for you to volunteer and get engaged. If you're not yet a member, we encourage you to join IPHA so we can continue providing this great work. And with that, I'm going to turn it over to Sam.
Yeah, hey, afternoon, everyone. Just to provide some quick context before I introduce Michael. For the most part, we're looking at launching our employee vaccine clinics this fall, and then as most of you probably came aware of, with Pfizer EUA being discontinued, we had to look towards purchasing Moderna for younger children. And so when we started having those conversations, came across and talked to our friends at Moderna, and they had mentioned that if you've got membership with MCAP, you could find different discounts on vaccination. And obviously, as good public stewards, we always wanted to do so, but started to learn a little bit more about MCAP and ended up reaching out to Michael. It has been extremely helpful and wonderful to entertain all of my questions, but really helped us save on our purchase this year. And we conveniently found out that we are actually already members and have been members since 2015. And that may be the case for your agency as well too, but just it's been really wonderful to learn more about MCAP and talked with Lena and the team and said, can we get this information out to membership? And so here we are today. Really grateful, Michael, for your time and looking to learn forward to learning more today, but I'll pass it off to Michael with MCAP to introduce himself and then the organization and what this could potentially do to help all of us save on vaccines and certainly a lot of other products as well too. So Michael, the floor is yours.
Well, thank you, Sam. I appreciate that generous introduction. I'm glad we're able to help your county, and that's really what I'm here for. I've been with MCAP for a little over 10 years now, and we act not at all as sales. We're the state of Minnesota, so I'm really act as more of a consultant, and I'm here to help everybody connect the dots to get best value out of these government contracts. So to give you an update, or really just an overview of MCAP, I guess, a 101. MCAP is under the Minnesota Department of Administration. So you can think of MCAP as government serving government. Everybody's a state employee, and all of our contracts are competitively procured in an open, public, and fair process. So any of the procurement folks out there, if you do have connections with procurement, it really checks all those very important boxes. Our wheelhouse is healthcare, and we don't stray too far from that. We really specialize on it because it's complicated sometimes. There are a lot of layers, and vaccines is one of those places that has those layers. And if I can hit my share screen, oh my goodness. When you have two screens, I'm sure some of you have struggled with this. Things move around in unexpected ways. So I do have some slides, and I really would encourage anybody that has questions along the way to, pop them in here. This is kind of a working meeting. I want to expose you guys to as much information as I can, so I'll kind of do a little bit of a broad strokes here. But if you want to get down in the weeds, I do Teams meetings directly with city, county, state buyers. Am I successfully sharing my screen?
You are, Michael. We can see it.
Okay, thanks. So MCAP is government serving government, and here's a quick look at our org chart. I don't know if the font sometimes comes up a little bit smaller, but the takeaway here is that MCAP has accountability. We report up to the state's chief procurement officer. So that kind of builds in really the securities that these contracts are competitively procured. And the state of Iowa also uses these contracts. So as a state agency, they're posted out on your state procurement's website. I have a counterpart there in the Department of Administration office, and we share information to make these contracts available in Iowa. Each state, and it's important to note that MCAP is a national cooperative or a GPO. Some people know us as a group purchasing organization. So these contracts are shared with other states through a joint powers agreement or a JPA. That's really just the legal bridge to get the contracts from Minnesota to the other hosting state. When we do contracting, we're able to collectively bargain with all of these drug manufacturers, vaccine manufacturers, and the like, with that aggregated national volume. So while we're doing contracts for our own home state in Minnesota, it helps all of us when we work together to negotiate for price. Over the years, we've really brought in a lot of what I would call subject matter experts. So we have 4 clinical pharmacists on staff and a whole team of analysts that keep those pharmaceutical contracts moving ahead and competitive. That's one team. The other team would be the healthcare products and services team, and they cover everything that's not pharmacy. So think medical supplies, dental supplies, drug testing, condoms. We're expanding animal health and a couple other areas that include automation, but that kind of plays into pharmacy a little bit. Our members are largely public health. That when you look at the pie chart there, they take up the biggest slice. So there's a lot of spend with public health. We also work very closely with student health, state mental health hospitals, and Department of Corrections and county jails. So that's kind of who our membership is. In some states, qualified nonprofits also are able to access state contracts. So in Iowa, I don't know off the top of my head, but if you as a nonprofit, those of you might be out there, if you can access state contracts, you can access MCAP. If you're city, county, state, guaranteed membership. Membership is free and participation is voluntary. So this is really a true no risk proposition. I've covered a few of these things already, but we do follow the state of Minnesota procurement guidelines. Often these meet or exceed the guidelines in other states. If there is net new language we need, part of MCAP's job is to get that language in the contract at the state level through an MPA. So there's a lot of legal management that's behind all of these contracts as well. MCAP is member driven. We have state contacts, kind of like senators. Each state gets 2. One represents the pharmacy side, the other healthcare products and services, which is med supplies and dental. They attend a national member conference once a year, and there are extra members that also can attend representing the state's needs. So we're here to kind of fill those needs and really work together as partners. Here's a little bit about the contracts that I touched on already: pharmaceuticals, vaccine, general vaccine, diabetic supplies, nutritional WIC programs, and emergency preparedness. Emergency preparedness often means stockpiling Doxy and Cipro, and I'm sure there'll be something new in the future, but that's usually what we're talking about. Over on the healthcare products and services side, medical supply vendors like McKesson, Medline, Concordance, Medical Solutions as a smaller regional company, but there's a handful of vendors here that really helped us out and came through during COVID. Because if there's one thing we learned, no one vendor can serve all your needs all the time. So vendor diversification has kind of been a thing I've been working with public health on lately. Dental products, drug and alcohol testing, condoms, and animal health. So those kind of round out the lines of business in the healthcare product side. Man, this is even small for me. Connecting the dots. What this is here is those of you who have gone out to your state's procurement website. This is just a screenshot. When I search for MCAP in the keyword field here, these are the results you get. So you can see really almost all of our contracts are represented at the state level. So this, combined with your MCAP ID number, unlocks the contract. And that's a key takeaway, the importance of your MCAP ID number. Many counties, like Sam, you have one and you may not even know it. So you can check with me on that. And I'll check the roster, make sure you're aware of your MCAP ID number. But when you give that number to a vendor, that's how you unlock the contract and the pricing. So that's the hook. Here's a little bit about the website, and you can sort of maybe take a look at that live, and I'll show you how to log in to see if I think website access is really important, being able to see the contracts themselves, and you learn how to contact the vendor. And maybe are there some hidden discounts out there? And I say hidden because they're sometimes hard to find. And I'll show you where those are for general vaccines. It's taking things a step further, but for financial savings, it might be worth at least knowing where to dig to try to find those discounts. So this is a peek at our website. I've filtered for distributors of vaccines, and then the file I'll probably take you to live here in a second because it looks like we're going to have time. Gives you information about those contracts as well as pricing. And the last slide, this is, I don't forget to mention the importance of your MCAP ID number. And if you're opening a new account, give it to them right at the start. If you have an existing account, but you're not sure if it's attached to the state MCAP contract, you can send them an email and say, hey, MCAP is my GPO. Here's my ID number. Please put me under this contract. And then they'll do so. A little trick that I often do is I check the price of something I buy very frequently before that call, and then I'll check it again after they do it. And if you want to go through that exercise with me one-on-one, we can take a look at a couple items and say, yeah, this is definitely going to help. Or, maybe your contract is providing you good value at the time. So we want to know what you're stepping into. I'm confident it's going to be savings, but I think it's still worth checking. Let's take a look at that. I wanted to show you the MCAP website, and if I can figure out how to get this in the chat, I'll do that. It's going to require glasses for sure. Okay. Chat, found it.
I've got the link in the chat, Michael.
Oh, you beat me to it. You did. Yeah. Thank you. So anyway, this is the website. If those of you who are able to follow along on another tab on your browser, here is the login click path. So on the green activity bar, you click on members. This brings up the login page. And your username would be your work email. And if this is the first time you're logging in or you're not sure if you're even a registered user, click reset your password. This triggers a bounce back email if you're in our CRM. If you're not in our CRM, you send me an email and say, hey, I'd like access to the website. Can you get me logged in? And I'll run you through that process. Access to the website, obviously, you get to see all the contracts, contact information for each of the vendors, as well as, does that contract have a form for deeper discounts? You'll also get the monthly newsletter. MCAP does not send out a bunch of email, so that's kind of a good thing. Once you're at the landing page, you're going to see members and a box of options to the left. Pretty much everything you want to see lives in contracts. So that is our first click once we're logged in. And I could probably use COVID vaccine as an example because that was an active topic for Sam, and we're kind of in that season right now. So in this filter by category, there's a drop down with each individual line of business. Grab COVID vaccines. And let's check out the results. So you can see we have contracts with all three manufacturers. You can view those contracts, but not download them. Important distinction. And then you'll see last year's price file and our current season here, 25-26. This is version 2 so far. This price file is pretty helpful in that it gives you a lot of actionable information about pricing and about placing that order. And if you've got an invoice from something you've already ordered, you can also audit that invoice to see, hey, am I getting the right price? I don't know, must be in a field here. Let's try this again. Okay. So now we're looking at the COVID price file. The first tab here lets us know who the manufacturers are and who can I order from. These are the distributors, and then you can also order from a pharmaceutical wholesaler. The state of Iowa has selected Cardinal Health as their prime vendor. So while there's 3 listed here, Cardinal is really the only one you have access to. This is a kind of a unique case where putting all your eggs into one basket helps everybody. So when you do order, the entire volume of the state of Iowa is aggregated together to benefit the cost of goods discount. And that's another thing we can hit up for, I guess, additional layer of savings. So on the products tab, let me make this bigger because I'm sure it's painfully small. Kind of filter by what you're looking for. I think, Sam, you mentioned Moderna. So I'm just going to go down that road. Here's the products you can order, and then the vendors you can order from. And it's a pretty long spreadsheet. So to get into the value, you got to click and slide over. You start at the contract price, but then there are some additional discounts listed over here in P. And they're going to give you a heads up as to what they are. This line here is a pretty good one because it lists all 3 potential discounts. And there's even a 4th one that I'll introduce. So committed pricing is available from Moderna. Last season, they actually had a form. This season, you send me an email. Seems a little loosey-goosey, but that's how the vendor wants it. And you let us know who your chosen vendor is. And we get that price loaded for you at that vendor site, whether it's IPHA, McKesson, Cardinal. We have contracts with all of them. And then a preferred, this probably is a AAA line, I bet. Let me check. Yep, so triple F, sorry. So triple F is a preferred distributor for Moderna. So there's an additional 3% off if you order from Triple F. And then if you pay quickly, you get 2%. So that takes you out here to the final price with all discounts of 90307. And there's nothing beyond that. The fourth level of discounting really comes from ordering through Cardinal, and it's kind of like that. It's kind of like that preferred distributor discount, but it's in what you're doing is stacking up contracts. This is the Moderna contract. Then there's a Cardinal distribution contract. That is the one that provides a cost of goods discount. And for quick math, you can just plan on about 6% off if you're paying, inside 30 days. Did I have? You'll see the ordering options down here. Cardinal Health is one of them. If you do want to open up a Cardinal Health account, that's another trigger where you just go through me, and then I provide Cardinal all the information they need to get started. The other vendors, you can open an account on your own. You just provide them with your MCAP ID number when you call or email. So that's COVID vaccine. Vaccines are in 3 buckets for MCAP contracting: COVID, seasonal flu, and then general vaccines. If anybody is interested in a price file for general vaccines, there are 2 places that lives. The pharmacy catalog is one, and that's always available to members. It's a pretty big file, though. Let's see how many lines it has. And it's going to include all of the pharmaceuticals on contract, which makes filtering and searching certainly doable, but it's just there's more data to sift through. But everything is in the pharmacy catalog. Okay. Let's see, how many lines do we have? 15,874. So it's a lot. I have a price file with just the vaccines on it. I might have that up. Yep. It looks like this. I basically filtered the catalog for everybody and just said, okay, here's the vaccine pricing. And here's the hidden value or the added benefit of working with MCAP is you're going to kind of get into the granular savings opportunities when you start really learning about the contracts themselves. So vaccine manufacturers, particularly Sanofi and GSK, are playing a tug of war with your loyalty. So if you're able to pick one over the other 80% of the time, that vendor or manufacturer will give you a better price. And some have a form for that. Some have an online process. GSK has a form. Sanofi has an online process. The workflow is online. So the contract base price, as an example, for Adacel or Adacel, however you say, is $225.53. If you're in their committed program, it's $190. If you're in their committed program and doing pediatric vaccines, it's $188. Your biggest delta and bump in savings is what they call tier 2. Tier 1, best price, but that really depends on the future of vaccines for children, which is a federal program. MCAP has been approached by many providers to backfill and create programs in case that dissolves or goes away. So we're here as an option, and I think a pretty good one. Here's a look at one of the manufacturers' visual charts. For GSK, I just like it because it's one page. When I change screens, this doesn't follow, does it? Or
Join
does it?
us.
Do you see a
We
GSK Partners
we
file now?
we do.
Oh, great. Thank you. So I mentioned three buckets. So these are the performance brands. There's the pediatric bucket here, the meningococcal bucket, and then like the booster bucket. These are GSK products. If you're compliant 80% of the time on this side of the column, you're good. If you're compliant 80% of the time over here on the right side, these are all Sanofi products, and then you would want to look at their program. But this is going to give you the biggest delta, um, to help you with your reimbursement rates. That is, if you can get the providers to, align with one or the other. And when I look at data, oftentimes I find they're already compliant. There might just be like one item that they buy once in a while, or if you just switch one item over, into one of these columns, then they're all in. So often compliance is either already happening or very close. And then connecting the dots on that savings, when you're on our website, you would go to, let's see, just GSK down here, and we'll find that form. I hope. There it is. So GSK calls their program City County State Plus, CCS. So here's the form. One is to declare MCAP your GPO, and I tell folks just to fill both out. And the other is the City County State form. And for GSK, they'll tell you submit it to MCAP. We actually are tracking the data. So these again are kind of the buckets that I was talking about: pediatric, adult, adolescent. And if you can hit, these bottom two, then that gets you in the program. I think 70% on these boosters. Many of these require more than one, or meningococcal, sorry, require more than one course. So I think they're giving you a little more leeway if the patient walks in the door already started with the other brand, Sanofi in this case. So I'm right at time. I wanted to kind of get this basic stuff out, the importance of the MCAP ID, kind of get you thinking about web access. Vaccines, three, general vaccines, flu vaccine, and COVID vaccine categories. Other MCAP contracts. That would be my last one. So here's what else we do. Let's to our website. That's not what I wanted. I somehow lost our website. I would say the easiest place to find out, if MCAP can cover a need is log into the website, and then in the filter by category, you're going to see each of these lines of business. So all these categories have contracts behind them. MCAP generally does RFPs every 5 years. So you'll also be able to tell, if this is going out to bid again soon, the vendors could shift a little bit, but incumbent vendors, as you know, have a pretty big advantage when they rebid. So it's very likely that, those vendors get awards, and sometimes there are new vendors. In the vaccine distributing category, we picked up a new vendor out of Wisconsin, Medco something. Medical products program, probably the other largest line of business. This is all the vendors, and there's quite a few options for you. Concordance, Henry Schein, Cardinal, Loch Ness, specialty provider. They do lateral flow point of care testing and harm reduction products like fentanyl test strips and stuff like that. Then McKesson, probably the largest vendor, Medical Solutions, one of the smaller ones, Medline, the only manufacturer on this list. And then Premier does not deliver to Iowa, so you can scratch them as an option. But all the contracts are here. The file I find really helpful is the one at the top in the middle called contract release. You will also notice that price files over here. The price file is not everything that vendor has on contract. It's just a sample, so we can keep pricing in check, static pricing, auditing. It's commonly used items among all of our members are listed in that price file, but it's different. It's different among all the vendors. This file here gives you the need to know info like what are the terms of this contract and how do I get a hold of a vendor? I have a question. I want to open an account. This will help you get there. Looks like my machine's thinking it's Friday here. So here's where you get a feel for the terms. You can see when these contracts are awarded, they're pretty fresh yet. MCAP contracts typically roll out 2 years initially with 3 one-year extensions, and then we rebid. So you keep scrolling down, you'll get contact information for the vendors. Some of them choose to list the reps for your state. Others, you just kind of contact one person. At Henry Schein, I work a lot with Christina Bowman. She'll get you set up and started and, pass you off to a local rep. McKesson is very large, so they have a team of people on the end of this email address. All they do is government, so they're very used to asking you for your, tax exempt certificate, stuff like that. There's no credit checks to open up an account because you're associated with MCAP and in the government space. So the whole onboarding process is pretty easy with these vendors because of the MCAP relationship. Yeah. Yeah, they don't deliver to. Oh, they do. This was expanded. I stand corrected. So Premier Medical does, in fact, deliver to Iowa. They added a few states. They used to be just, out west, and they're kind of coming into the Midwest now. So I've hit all of my broad stroke topics. So I'm wondering if you guys have any questions or curiosities for me to kind of get you to the next step in your own programs.
Well, while folks are thinking about questions, if others want to drop in the chat what products or services they're hoping to save money on, we can get an idea of what brought your interest today. But absolutely appreciate folks' time. I'll say I know for us originally, like as mentioned, our conversation started with the vaccine, but we'll be looking at naloxone as well too. So.
Yeah, the naloxone program in Iowa, I worked with Heidi. She's the program manager for the grant funding statewide. So you can either get naloxone on your own, and we have very favorable pricing there. And for qualified users, I don't know what the qualifications are, but there is a statewide program that uses grant funds largely from opioid settlement money, and that gets kind of passed out to the state through the state naloxone program. It's look up her name. I think it's Heidi. Heidi Harrison. Yeah, it's Heidi Harrison at IDH Human Services. Yeah.
Michael, I think it sounds, silence is probably a good thing. It sounds like you hit all the high notes.
Well,
But
I hope so. And you guys have my contact information through this meeting. I'm also out on the website under like contact us, I think, just click on Midwest. So if you do want to reach out, find out, hey, what's my ID number? Help me with access or navigating the website. I'm here to kind of help you do that.
great. Well, Michael, thank you again for your time. I absolutely appreciate the offers for our members to reach out to you to learn more. I'm sure all of us are looking at budgets this time of year and kind of the path forward on how we continue to serve and provide services. So,
Mhm.
Michael, thanks again. And for everyone else joining today, thanks for joining.
Appreciate it. Thanks for meeting with you guys. See ya.
Well, if that's it, we'll wrap up early and give you